Live.
Good morning to all the listeners out there.
So this makes for some very concerned, reading and engagement where one picks up a paper and it says, well, 38% of doctors plan on leaving the country should NHI become a reality when we already have a shortage of doctors in this country.
It is a problem. It's a huge problem that we are facing. One of the, I think we need to clearly understand that although it's said that 40% of doctors or 38% of doctors threaten to leave the country if it's been implemented, it's more about the bill in its current form. The objections were against the bill as it is currently standing, not so much on universal health coverage. The Medical Association are clear on universal health coverage, and our members understand that universal health coverage is extremely important to implement, and we fully support that part. But the current bill as it is needs amendment before our members will look most favorably upon that bill. So the complaints were about the bill in its current form. Not so much that NHI should not be implemented, but the bill leading to NHI currently needs amendment.
So which parts of the bill are your members concerned about?
Well, the majority of members were concerned about the corruption part. We asked them questions about corruption, and that was the leading concern. Now, unfortunately, if you look at the SOEs and the current state of the SAA, as well as the ESCOM, what is happening, it doesn't matter how many times the Minister is trying to assure us that the NHI will not, the funding will not be part of an SOE process, and that there will be enough bells and whistles built into that, or regulations built into that, to make sure that it doesn't go the same way as the current SOEs. For the average person out there, for the average doctor who's not interested in politics, all they know is what is currently happening, and of which ESCOM and SAA are the best examples that we have. So in their mind, and in most of the people out there, not only the doctors, in the public's mind out there, is, oh gosh, NHI is going to go the same way than the ESCOM and the SAA, and my money is going to be put into a pool, and I've got no guarantees that I will get universal health coverage or appropriate primary health care.
So I'm not sure that I clearly understand the concern of the doctors with regard to the bill itself. Because, yes, we understand the corruption issue is a perception issue yes, more than a function of the bill itself. So when it comes to the actual bill, are there any provisions contained within the bill that your doctors are balking against?
Currently, they are having concerns about the fact that the ministers would have the power to constitute the different committees. And I feel that the current minister is very pro-medicine, and he's a very open person that we can communicate, but we don't know who we might get in future. So currently, we've got a good minister, and we will hope that he will appoint the correct people into that positions. But going forward, there's no guarantee. So for them, or for my members, this is a concern, because it will then depend on a personality, and it should not depend on a personality. And then also the funding itself, the way that I'm going to receive my monies if I am part of the system, how is that going to work? How are we going to make sure that there's no corruption along the way? That the so-called, what they call the caps, that would be fair, and that it would be not only fair in the remuneration process, but also be fair that I can give services to the public out there.
Which is a very interesting question in and of itself, not only for the doctors, but even for consumers, patients as well, because when we talk about the remuneration for healthcare services in this country, it is, a very sensitive topic, because by and large, South Africans feel that they are being fleeced, that healthcare in this country is very expensive. So doesn't this perhaps present an opportunity to dialogue around that particular matter by all stakeholders concerned?
I think so too. I think this is a very good time that we can capitalize on this and say, listen, what is wrong in the current system? Also remember that in the public system, we have a lot of problems in getting patients into the system from primary healthcare system side, and also then the quality of services that those patients receive, again, at the basic level. I'm now talking about primary healthcare level. So we need to look at that, make sure that that is being upgraded to a more level that you will get into if you access the private care. So it should not be making any difference whether let's say NHI is now being implemented, whether I go to my general practitioner or when I go to the local clinic. The services, the quality of service must actually be the same. So that's the first thing. So we need to look at that, and we need to see how can we uplift the public system to get that right. Then on the private sector side, we need to make sure that the funding, the benefit design from the medical schemes, that is very problematic. As we currently, from our side, you have so many benefits. If you look at Discovery, so many benefits, the patients get confused, we get confused, and each and every benefit's got its own rules and regulations, and it's not only related to Discovery, it's most of the medical schemes. So that gives a lot of confusion out there, creates confusion. So if I am a patient and I need to make sure that I get care also at the primary care level in private sector, there should be enough monies to also make sure that I can be treated at primary care level and not being admitted in the hospitals at higher costs. So we need to look at that. So benefit design for the medical scheme side is a huge problem, and then how to get the public sector to have more or less the same quality that you will receive currently from a family practitioner in the private sector, so that we are on par there.
So if we peel back the layers, is this not just a matter of the medical aid schemes being concerned about not making the exorbitant profits that they are currently pocketing?
It's difficult for me to give an opinion on that, but my gut feeling will say yes, it is. There's definitely profits behind this. One of the things that we have seen is that, generic medicine should be prescribed by us, or if I prescribe an original product, when the patient goes to the pharmacist, then the cheapest or the most appropriate generic should be given to that patient. But what we are currently seeing is that the medical schemes became prescriptive and say to us, you can only use product A, which we have a contract with. So, it just boggles my mind. And I've also seen that some of these so-called generics that the medical scheme insists that you can only use that generic are more expensive than some of the other drugs. So it's not even the most cost-effective or the cheapest drug that we are now prescribing. For me, it would be more prudent to say, listen, there should actually be only 3 medical scheme options: a low-cost option, a middle-class option, and a higher-cost option. And then it should not matter whether I go to medical scheme A or B or C. I know if I pay this amount per month, this is what I'm going to get. They should be competing more on how they treat their customers, more on service delivery than on the actual benefit design. So if you can get the benefit designs right, not so confusing as it is currently in the market, and 2025 comes in, and let's say, for argument's sake, at that stage, that the primary healthcare part of the public service is on par with the primary healthcare part of the private sector, and then medical schemes are obliged to give only certain services. I don't think it would then matter if I then choose to have a solid medical scheme for all my desires and my wishes than going to the public sector. So if you're then willing to pay that price for a higher option, then so be it. But if you are willing to pay the price for the low average option that everyone will get, whether you're in private or public sector, it doesn't really make sense to me then to then say I will still need my medical scheme. But if you want that, I think it's your choice in the end of the day to say what you want.
That's a very interesting revelation, because the picture it paints to me, listening to what you're saying, reading what everybody is saying, looking at the outcomes of some of these surveys, it would seem as though, doctors feel that they are caught in this space where they don't have much of a say in terms of what the medical schemes are doing, the medical aid schemes. They don't have much of a say in terms of the legislation that has been enacted around them. Is that how doctors are feeling at the moment?
Yes, that is how doctors are feeling at the moment. And is it true? On the medical scheme side, from SAMA's side, we engage a lot with the medical schemes. And some of them are very open to reform and to listen to what we are advising them. Others are not so much open to it. And, the ones that are open, I think they are starting to see benefits better and see the outcomes. Because in the end of the day, especially in primary healthcare, it should be preventative medicine and outcomes driven. It should not be curative, meaning I have now my heart attack, now I need to get all the services. If I'm 70 years old, I should have been going to see my general practitioner at least once a year, make sure that I am healthy, as to prevent an adverse reaction that's going to cost a lot of money. And yes, that makes doctors feel that they don't have a lot of say. But again, from the National Department of Health, we are currently engaging with them, and we also see that they are willing to listen to us. So, but in the end of the day, to be willing to listen to us and to get it implemented is two different things. And it will lie, the proof of the pudding will lie in the practical implementation of what we all want in future.
So why do doctors feel that their livelihoods are being threatened by NHI?
For me, again, and if I look at the survey, I think it's the uncertainty. They know what they get in the current system from now I'm talking about the medical scheme side. They know what they're getting. They know the devil that they are serving, and the NHI is a devil that I don't know what I'm going to get from. I don't know whether I would be able to still see my patients in the way I do. Maybe I need to change some of my practice behaviours, but I don't know. And remember, there is no clear guidelines yet out on that. It's only a bill looking at the funding. And doctors are already looking at, again, what am I going to get out of this, remuneration-wise, and will I be able to serve my patients?
So what are some of the discussions that you are having as a representative body for doctors with government in terms of that?
First of all, we did submit our presentation to the Parliament regarding the concerns that we have on certain aspects of the bill. It's not that everything in the bill is wrong, but there are huge concerns, and again, it's around the funding and the security that, or the confidence that there will be enough oversight and that we don't or won't go in the same direction than the ESCOMs and the SAAs. So if we can get that right and they listen to us, and if we can then also, make sure that if you want to have your medical scheme after 2025 and you are willing to pay that monthly contributions, then so be it. Then you have to understand that you will unfortunately also be able, or you need then to contribute to the NHI scheme as well. So you will be double.
But is there a provision that says that will not be available to you?
Currently, what the bill is saying, that if once the NHI is implemented, and running and working, then they will start looking at, let's say government says to us or state says to us that they will provide all the services for high blood pressure, then the current feeling is that, or the idea currently in the bill is then that you would only get that services through Department of Health or through the NHI system. Now, a lot of patients feel threatened by this and say, I would like to keep my medical scheme, and I would like, although I know that I will get my services for high blood pressure from the state, I would prefer to get it privately. So I think that will be a minority of people in the end of the day that will still want to have their medical schemes. So for me, it should not be a huge debate. It should just be there. If they want it, just leave them to have it.
Absolutely. Isn't that the case right now? Right now it is
Yes.
more a class issue. It is
Yes.
more an affordability issue whereby
Yes.
people who can, choose to have, their services rendered at a private facility. So I'm still trying to understand what exactly it is that doctors are so concerned about regarding the bill, because it would seem as though perhaps there's a need for more engagement and a better understanding of what this will entail.
Yeah. I agree. I fully agree with you. But the fears of the doctors, again, it's around the monetary. How am I going to get paid? Am I going to get paid? Is the services going to be able to cover the needs of my patient? That for the doctor is extremely important. Will I be able to still service under a medical scheme, contract by a medical scheme, or should I now only be contracted under the NHI system whereby I don't have any say anymore? If you look at the specialist groupings, they have very strong organizations and they are lobbying for them, and I think they will always be there. From the family practitioner side, we don't have that strong lobbying organizations, although I need to say that the different doctor groupings have now come together and formed a unity forum group, so to also start driving primary health care, because that is the backbone, and universal health coverage would be the backbone of NHI. And again, if it must be up from us, it should be our responsibility, the profession's responsibility, to make sure that the correct formularies, the correct protocols are being implemented, for example, for hypertension, so that we are making sure that the same services that gives good outcomes and preventative medicine be implemented. It should not be the prerogative only of the Department of Health. We need to come and we need to sit with the Department of Health and say, listen, this is the formulary that we see that is working. I know drug X is 10 cents, but it's not giving you good outcomes. So let's rather look at a more expensive drug with better outcomes, because that will bring down your secondary and tertiary costs. And this, for me, is a golden opportunity for us as medical practitioners to look at this. But currently, everyone is looking at, money is going to be still, there's no good track record.
Or perhaps we're just not going to make as much as we are currently making.
Maybe,
because
that's true.
If you think of something such as just having a baby, in South Africa at the moment, if you are on medical aid, you are almost being coerced into having a cesarean section.
You see, that is the fees from the medical schemes. Most of the medical schemes, whether the doctor performs a cesarean section or a normal vaginal delivery, is exactly the same. So I think that the coercion into getting a cesarean section is lying at a different, not so much at the money level, but at another level where it may be convenient for everyone, and it's
But how many doctors are involved if I'm having a vaginal birth as opposed to when I'm having a cesarean section? The cost, is it really the same?
The cost, that's the fee that's paid to the doctor.
To the
Yes.
one doctor?
Yes. It's
But what about the other people, the support staff? You're staying over in hospital a little longer. All of those costs tend to add up.
Yeah, no, on that, I am full agreement with you. But if you look at the cost of the doctor, regardless whether he does a cesarean section or a vaginal delivery, his cost, his remuneration for that procedure will be the same.
Dr. Coetzer, you know, I hope we can have a roundtable discussion around this particular matter, because it would be interesting to bring the various viewpoints together. And I think some of the concerns are valid with the doctors, but it would be really interesting to drill down into the nitty-gritties of the bill to see where we should be alarmed or not. But thank you so much for informing us about those concerns. And it is, of course, alarming that some of our doctors are thinking of leaving the country because of the introduction of the National Health Insurance Bill, and the fact that they actually do not understand what the future would hold for them should this come to pass. But thank you so much to the chairperson of the South African Medical Association, Dr. Angelique Coetzer. And